screen, so.
And we're referring people to our website, or they will be emailed?
No, you're going to tell them that they're going to be emailed the survey.
Okay.
Survey will be emailed, and they will receive a thank you for participating.
Okay.
So, because I can't see it. Okay. Good. And this is a problem. I can't see the people.
I can let them in if you would like me to.
Yes, can you do that for me, please?
Sure can, yes.
Because I can't see them.
Oh, it's actually not letting me do that. I thought it would.
Oh, see, I'm the only one that can do it. Okay, hold on.
Oh, no, I did. I said I pressed admit all. I don't know if that's what else is supposed to do.
Yes.
Okay. Good morning, everyone. Thanks for joining the FIPCO Virtual Community Health Fair. We will be sending out a survey later this afternoon with just a quick questions asking about your experience in the fair, and we would appreciate your feedback. This recording, as well as all the other presentations, will be available tomorrow on the event website. You can actually just click on the presentation you would like to view, and you will be able to access the video. I'd like to welcome Jose Luis Madera, who will be presenting on mental health today. Thank you so much for being here, Jose.
Thank you. I will share my screen here so you guys can see my PowerPoint presentation. Good morning, everybody. Hopefully everybody's doing well today. I know that I started a little bit later than most folks because of just some time constraints that I had, but I am available to chat a little bit longer after I know the time is supposed to end at 11:30. So if there are any questions that you have during the presentation, feel free to ask them. And we will try to answer them during, or if I'm allowed to go a little over, I will. But again, my name is Jose Luis. I work for Valleywise Health. I'm the clinical coordinator of the Integrated Behavioral Health Services. We'll go a little bit into detail of what that services looks like within our FQHC clinic system. But today's objectives, I really wanted to know what are some of the things people are interested in learning today. So if you do have any questions or there are any things that you really wanted to get out of today from today's time, please let us know through the chat box. And some other things we're going to talk about today is about how language matters when it comes to the stigma of behavioral health. We do want to talk about the difference between a behavioral health crisis and emergency. I think that depending on your level of comfort, sometimes people see everything as an emergency, but we really want to ensure that we're not overreacting or making people feel terrible for having needs for behavioral health support. And then just some ideas on how to support others who are having struggles with behavioral health, especially during COVID. And then I do want to talk a little bit about what integrated behavioral health services look like within Valleywise and how we can support you, those who are attending today, and also your loved ones if they are part of our system. Now I'm having technical difficulties. There you go. So there's one thing that we do like to talk about with integrated behavioral health, that there's no health without behavioral health, right? So everybody's health matters, and a lot of people tend to focus on physical health, but really behavioral health is really part of the whole body. So we want to focus on people's physical and mental health, and to ensure that they're having great care. So for the question that I had posed earlier, what are some specific topics that or situations that you're hopefully wanting to get some assistance with in today's talk? So I think, Chiquita, if you are helping moderate this, if you could just let me know about the questions in the chat box, if there's any that do come up. So hopefully our objectives do cover some of that.
Yes.
Some of
Of
the
course.
areas that people are concerned about. But the one thing we want to talk about, number one is language matters. So we want to be extremely cognizant on how we speak to others about behavioral health concerns and needs. We want to avoid using terms that might be offensive. People like to call people crazy, or they're falling apart, or they're doing all these, they're saying all these things that, even though it might be cute or funny in the moment, the person who's experiencing the difficulties will internalize that, and that comment that might have been trying to be done for laughs might be taken very personally. So we want to just make sure that we're not categorizing people, stereotyping people, or even really shaming people on these different topics, right? So we want to make sure that we are being inclusive in our conversations and not talking to people at them, right? The thing that tends to happen when people are concerned about other people's mental health is that they will talk at them. They will tell them what to do. They will tell them what they think they need to do and all these other things, but not really engaging them to see on how they can be helped. So language really matters. The way you talk to folks about these struggles that they're having really is going to help guide them in getting support or not. Because if you go about it one way, it could be a way that people are taking the information very poorly or sensitively, and then deciding not to get help. And that obviously at the end of the day can become a problem. So we want to talk about crisis versus an emergency. I think that earlier on when I was talking, depending on your comfort level with behavioral health concerns or needs, everything might be an emergency, or everything just might be a simple crisis. And I think that we have to be really cognizant of that if we're not minimizing situations or not. So the one thing that we want to also highlight is that behavioral health emergencies and crisis can be experienced by anyone, right? I think folks tend to think that it only happens to a specific subset of people, weak-minded people, what have you. But really it can happen to adults, children, family members, friends, strangers, basically everyone and anyone. So the one thing that we want to talk about, I think I went back or ahead of time, was it's important to know the difference between a behavioral health crisis and an emergency. The way I like to simplify it is a crisis is a non-life-threatening occurrence, and an emergency is a life-threatening occurrence. And any crisis can escalate to an emergency. So we really want to make sure that if you have family members or folks around you that are saying that they want to hurt themselves, that we take it very seriously, and that we contact those people that we that can assist them. If it might be the crisis line, connecting them to services, or a church member or group or someone that can provide that kind of support. We just want to make sure that we're listening to people and hear what they're saying. Now, if an emergency in my mind is if someone has an actual plan. So someone might say they want to hurt themselves but have no real plan. That might not be considered an emergency, but for sure it is a crisis. But if there is a time where someone is having a plan that they want to hurt themselves or somebody else, we want to make sure we get the appropriate parties involved. One thing that we should look at for folks, especially right now during COVID, I know that this is a very hot topic, behavioral health, is we want to look at people's changes in mood, if they appear to be more anxious, depressed, irritable, if they report having difficulty of sleeping, increases in substance use, or even obviously suicidal thoughts, right? We want to just make sure that we're looking for these things, that we're asking these questions, that we're really connected to people and asking them to, open up to us and really be there for them. We also want, professional support looks different all around. I think that obviously I'm a behavioral health professional, so my go-to is counseling or a psychiatrist if that's needed, but that's not necessarily what everybody needs. Supports can be on a professional level, but they also can be at the community level, like an elder or another church member or something like that. Anybody that somebody feels supported by and they're getting better. I think for me, it's the most important thing to do. It only takes a moment to help. So I think people often think like, oh, I don't want to breach that subject. I know that if anybody's ever done like an eval or done any kind of questionnaire with people, there are certain questions that you really struggle with asking because you know that once you ask that one question, it opens this huge Pandora's box of problems, perhaps. But we want to make sure that we're still asking and we're taking that moment to help people because I know we're all busy. We all don't have time for things. One of my favorite phrases to say is, I don't have time for that. Even though I say that, I rarely mean it. But it is important that we do take that time, ask people how they're doing and mean it. Because if you're just asking as a reflex common courtesy kind of thing, and if a person is really truly struggling and they're saying, oh, I'm really struggling right now, and you're like, oh, well, that sounds terrible, and then you don't do anything about it, they're going to be very discouraged. So really ask with some intent. So ask people how they're doing, be open to helping others, state what is concerning you. So if you see somebody that is acting anxious or more depressed, or that they're even using substances, legal or illegal, more than they tend to really ask them, like, I noticed that you're doing this. Is everything okay? Not just blaming people or saying like, oh, you're doing all this, you're hurting your life, you're breaking your family apart. If you do all these yous instead of telling people the I, and which is the next recommendation of the I statements, we really want to encourage that with others, right? Using I statements, talking about how you're experiencing things and not blaming and shaming people. I talked about the providing the support and meaning it. Make sure that you understand that you are available to talk, right? You want to make people know that they might not be comfortable today, but you want them to understand that they are comfortable in the future, that you are comfortable taking in information in the future. Other things that we've talked about a lot, which I'm sure if you've listened to any kind of COVID-related conversation or to help people with that, is we really want to encourage people to engage in routines and doing socially distanced activities, just things to get them up and moving. Because, as isolation has become a bigger thing, depending on how serious people are wanting to take COVID. There are people that are living their lives quite normal, and we see that on social media and other places, but there are people that are taking this very serious. And I think for those folks that are taking it very serious and isolating themselves, there is a higher probability of them becoming depressed. So we really want to just encourage people to have a routine and be positive. The other thing that we want to encourage people to do is to reach out to other people and to not fear of rejection. Because I hear this a lot. Like, I reached out to them, they pushed me away, I'm not doing it again. And it's just like, okay, I hear that it hurt your feelings that you reached out and they didn't take your support. But really, go with the idea of, I'm offering support, and if they take it, good. If they don't, I'll always be here. And then the idea of focusing on people's strengths. I think we have a tendency of telling people that they're weak or weak-minded, and really looking at what their strengths are, because everybody has strengths. It's sometimes we need to hear it from a third party or a loved one to remind us of our strengths. And obviously the last part is to make a plan. If there is a person that truly is struggling and they truly need support, we want to walk away from that situation with that person having a plan, right? That they're going to call this place, that they have the number. I'm going to call you tomorrow. I'm going to double check to see if you made this call, and to ensure that this plan is in order. Because like anything, if you just say that something's going to happen and you kind of, wishful thinking, it doesn't really get very far. So we want to make sure that there's a plan to help people. this infographic by the National Institute of Mental Health, I thought was really interesting and helpful. And I realize I keep talking. Are there any questions, Chiquita, that have been dropped by?
No questions yet.
Okay, cool. So anxiety and COVID, this infographic here shows some symptoms that both anxiety and COVID have in common, and that some that are exclusively separate. And I think that right now, I get the sense that a lot of people are more educated on what COVID, because there were so many unknowns in the beginning. Now it's a little bit more, we can understand the symptoms and what's going on more often. So when COVID was newer to the game, it's been about a year now, surprisingly. It went by so fast. Some of the symptoms were being confused by people, and really they were having anxiety attacks, but they really thought they had COVID symptoms. So I think that we don't want to minimize people's feelings. If they feel like they need to go to the doctor because they're having symptoms that they are attributing to COVID, I think we should listen no matter what. Sometimes the answer is going to be, which I've worked with several patients because of that, is that they're just really having an anxiety attack, and just really talking to that person about their anxiety about having COVID or getting COVID or their family members getting COVID. That's really the important part of it. Is if you take somebody, listen to what their concerns are, and assist them in getting help, we can find out a lot more information.
Jose, we do have one question.
Sure.
When do I know it's time for me to get help, or help for myself versus self-help, or me helping others? So
yeah. Actually, that's a topic that I'm going to talk about in a little bit, but I will I'll go to that and then come back to these de-escalation tips, because I think that it's also important. But the idea is to remember to take care of ourselves, right? I'm in a helping profession. I can speak for myself in the situation, and I tend to think of others before I think of myself, which is not a terrible thing. But in some cases, we let ourselves go, and then we don't realize, oh, wow, I haven't done this for a while, or oh, wow, I haven't done that. I think that to answer that person's question, if you're asking yourself that question now, I think it might be a good time to just consult with somebody to see, what kind of support might be out there and available, just to talk to someone, just to really kind of process some of this stuff, right? Because we talk about self-care a lot, and we talk about helping others, but self-care for me has become a heavily used buzzword that requires action, right? So if you just keep saying, I'm going to practice self-care, but never do it, it really doesn't have any substance behind that. I think I'm answering the question. Was there another part of the question?
No, I think you did a great job. Yes.
Okay, perfect. And the other part also is using boundaries. If you feel like you're giving too much of yourself, I always encourage people to stop. It sounds terrible in this context, but if you feel like you're giving too much and you're not getting in return, you might need to take a break, right? You might need to say like, okay, this is not working for me right now. I'm helping, because we're talking about helping love others, but really if you feel like you're giving too much of yourself, you need to stop. Because at that point, people who are depressed or experiencing anything, anxiety or whatever kind of mental health issues, if you're too much in the muck of it, you too will start having those feelings. And so sometimes we have to practice those boundaries, right? We want to also make sure that we're not working harder than the person that is needing help, right? We want to empower them instead of enable them.
Jose, no, that just brought to mind something that I'm often thinking about is what are some examples of self-care? And I mean, it's not the same for everyone, but that point that you just discussed of boundaries, setting boundaries for oneself is, I think, a great example. Sometimes when I hear self-care, I think, oh, you know, a manicure, pampering myself.
Right.
But that may not be, you know, what's right for every person. So,
and it's also not feasible for everybody, right?
Exactly.
I mean, I hear this all the time. I'm going to get a massage, self-care, and it's like, oh, that's adorable, but not everybody can afford $100, $50 massage. I don't think
Right.
that's. I think it's a poor message to send to people, and I think that at some point, and this is for another conversation for another day, I think that the messaging of self-care becomes, I'm not good enough for it, right? Like, I can't afford that. I can't do these things. So then I don't deserve self-care. And really, self-care is a very individualistic thing. Like, for me, on a personal level, I know it's not about me, reading in quiet is my self-care. And that costs nobody anything. Maybe silence, because that's sometimes hard to get by during this time, right? Because everybody's home. But you know, silence and reading a book is my safe place, my self-care. So I think it really has to be individualistic, but we also want to encourage things that are low cost and really don't require, especially right now during COVID, interaction with other people that are so close in proximity, like a massage or a manicure or pedicure.
Yes, thanks so much.
Yeah, no worries. The idea of empowering versus enabling, I think that is sometimes a foreign concept for people. They think, oh, I'm helping them. But really, helping is a big thing, right? We want to make sure that they're also helping themselves, because we can give them all the resources. We can, I mean, I've done this for my whole career. I've made appointments for people. I've taken them to their appointments, but then I can't make them do the follow-up, right? There's so many things, there's so much we can do, and we have to encourage people to be empowered and you know, work for themselves at this point. And then the other part, and I think this answers greatly the one question, is really taking inventory of your own behaviors, right? Making sure that you're taking care of yourself, and ask for help when it's needed. So there's that. I don't know if there's more questions. I think I see things like flashing in front of me, but I don't know if those are questions.
No,
okay.
Just 5 more minutes, Jose.
Oh, I think that might have been the flashing that I saw. The presentation I shared with the folks running it, I did borrow 10 escalating tips from, and I want to say their names, crisisprevention.com. They have some really great tips for those folks that are trying to help someone de-escalate. But I really think when I saw the presentation and I looked at it, I thought it was great for any situation. It doesn't have to be that someone's in crisis. It could be any situation that you're just trying to help somebody. It really is some great tips. But I know we're at 5 minutes, so I don't want to go into huge detail with them. But I am going to highlight one, just because it's one of the things that I talk a lot with my staff and people that I've supervised, is allowing for silence. For whatever reason, and I'm sure there's a study or someone can tell me why, people are extremely uncomfortable with silence, and they don't allow people to think, and they don't allow them to make decisions for themselves. So they hear the silence, it goes on for 30 seconds, it might feel like 7 hours, and they start interjecting. They start saying, oh, you must be feeling depressed, or you must be feeling this, or you must, and that person's now no longer focusing inward, but now they're focusing on you, on how to get you to stop talking. And so in many ways, they either agree or they minimize. And I think that we just want to allow people silence so they can make those best decisions for themselves. A little bit about integrated behavioral health. I know we're at 3 minutes. Value-Wise Health does provide integrated behavioral health at all their FQHC clinics. There are some that don't have necessarily integrated behavioral health, but they are able to refer out to one of the sites that does. There's more that do than don't. We do help with general mental health problems. The nice thing I feel about integrated behavioral health as a whole is that if clinician or the behavioral health specialist that's working with that individual finds that the service that's available at the clinic is not suitable, they will make the referral and assist the person in connecting to a higher level of care that might be needed. And I think that that is extremely crucial, because sometimes, as anyone that's been on this call perhaps has experienced, that sometimes referrals kind of go and they're sent out, but they're never followed up through. And I think that when you refer to a behavioral health professional, they know what the best services are typically, and they can encourage that person to seek those services. So if it's either a psychiatrist or getting a specialized level of therapy, you know, or to see a psychologist for a specific testing that they might need, I think people lump in behavioral health as one big thing, which is not always a terrible idea, but a behavioral health professional would be the best person to help find those services. And these are just the sites that we have and the locations, and I will bypass that. Some important numbers to know. Obviously, the Maricopa Crisis Line is extremely helpful. They are your go-to. I think that if you're having someone who's having a behavioral health emergency or even crisis, they could help you determine if you're minimizing the crisis and it's really an emergency. But I really encourage to use that number, which is 602-222-9444. Obviously, for most emergencies, 911 would be suitable. And I think I'm at one last minute. Here's some resources on helping folks with who are struggling with suicide and suicidal ideation. The one thing right now during COVID, their resilient crisis counseling does provide short-term interventions for residents of Arizona, and you can dial 211 or 1-877-211-8661, and they will be able to provide free counseling for folks that can't afford it or don't have insurance.
Thank you so much, Luis. This was a wonderful presentation, and for everyone who wants to access this information, it can be found on the easthillstream.com /FIBCO website. And we appreciate everyone for attending. And thank you again, Jose.
Thank you.